Hashimoto's is an autoimmune response that affects everyone in the world. It's a precursor to the Parkinson's, the shaking disorders, which we test for. It's a precursor to Alzheimer's. For instance, 50% of all Alzheimer's is caused by the autoimmune response. I discovered how to reverse it in my clinical trials on 2,200 people over 3 years. On peer-reviewed, published, FDA approved. I have all the approvals. And we found out how to reverse it. The first place that it goes to is the digestive tract. The digestive tract has a negative feedback back into the brain. So it causes problems with the functioning of the brain as well as the digestive tract. And of course, it keeps on getting worse and worse and worse. If you don't fix it, it cuts 6 years off the average expected life expectancy. We have a very, very simple method of reversing Hashimoto's.
Welcome to the Too Curious MD podcast. I'm Dr. Alya Ahmad.
And I'm Dr. Alya Ahmad.
With the wisdom from holistic, alternative, and these conventional medicine, we are here to challenge the status quo.
We're curious about the connectivity and complexity between diverse fields of knowledge as they relate to consciousness, chronic illness, mental health, resilience, and beyond.
Learning more about the art and science of healing, or listening to stories of extraordinary healing. You're in the right place. Let's dive in. Welcome to the Too Curious MD podcast, where medicine is more than science. It's story, art, and connection. Today, we have a special guest who is Daryl Turner. And Daryl Turner is a founder of NiTek Medical. And he's an international lecturer. I just learned more about where he lectures kind of all over the world. His passion is towards assessing thyroid, adrenal, iodine, and hormone health. And we're going to really explore the importance of thyroid health. I particularly am interested in focusing on thyroid health from an international expert and researcher, Dr. Daryl Turner. So welcome to our podcast.
Dr. Alya, thank you for letting me explain why your quality of life matters and how we can make it better.
Yeah. Well, what led you first? And tell us a little bit about your background and your career in thyroid and hormone health, and how did you kind of come to this place where you're at right now?
Sure. I was born and raised in New Zealand. I live in America. Patients would come in and we'd run the blood tests and had all the symptoms, and we'd have to say, I can't help you, even though they were symptomatic, because their blood tests appear to be normal. And I thought, you know what? There's got to be a better way, because I want to help these patients. They crawled in. I said, I can't help you. And they crawled back out again. So I decided to investigate the old-fashioned method of looking at thyroid. And that was the speed of the reflexes. When I was born in the 90s, and when I was young in the 1940s and 1950s, my doctor used to sit me on his table and hit my knee with a reflex hammer, and he would judge the speed of it. When a baby was born, when all babies were born, they used to do a thing called a heel kick test, where they judge the speed of the response to a heel kick. In other words, is tightly correlated with thyroid, that the reflexes, and we all learned this in medical school, speed up and slow down with thyroid function. So I decided to develop a modern way of testing the speed of the reflexes, which I was able to do. I started with the Achilles, where there's a lot of research papers in and around the Achilles and the speed of the reflexes, and thyroid is very tightly correlated. And then I moved to the brachioradialis for ease of for use. So I developed a device called a Thyroflex that actually tests the speed of the neurotransmitters in your brain, which, as you know, the brain has plays a major impact on thyroid. I tested the speed of the reflexes, and of course I specified the amount of calories that you burn per day, because the thyroid controls a little energy engine that actually produces your energy. And if you don't have enough thyroid, you don't have enough energy.
Tell us more about how this correlation occurs in your device and how you actually make that correlation. I'm very curious. I mean, but first I'd like to, that's one question, but I really want our audience to understand kind of what you're speaking to. How does one assess thyroid function conventionally currently?
Thyroid function up until the mid-1970s was assessed with the speed of the reflexes and these symptoms. In the mid-1970s, the medical societies went over to blood. Let me tell you about blood. According to Sir Dr. Richard Bayliss, head of the Endocrinology Society in Europe, he stated a few years ago at the endocrinology meeting that be it TSH, T3, T4, FreeD3, FreeD4 are not valid for determining thyroid function. He then went on to say the only thing that is valid is the speed of the reflexes and the symptoms that the patients tell you about.
Yeah, I definitely want to highlight that patient symptoms are very much underreported and often ignored when we're thinking about thyroid health. And yes, I do agree with the idea of catching the labs at the right time. It's almost like we wait too long to catch those. When those labs are considered abnormal, it's almost too late. And it's more retrospective. This is my opinion of, thyroid function has already been affected by the time that we are able to see the laboratory value being abnormal. Because I agree with you, the thyroid is a master controller of the body.
Yes.
And there's subtle ways it may show up in symptoms and as you described in reflex assessment. And you're absolutely right. One way to assess neural health is a good neurological exam, and checking reflexes is very vital. And how often is that done? So
yes.
There's definitely evidence to say that we're missing the symptoms. We're not testing for symptoms or even the subtle symptoms. And we're relying conventionally on laboratory data, which is by the time you get it, it's already too late. So tell us how your Thyroflex works.
Well.
Yeah. How does your Thyroflex work when it comes to making that
Sure. I'd just like to reinforce what you just stated there. Your thyroid is what we call the grand central railway station of all of your well-being. It controls so many things in your body. And number two, thyroid is hereditary. If your mother or father has it, nothing you've done wrong, you will automatically inherit it. Whether it is picked up in time or not is another story. Excuse me. The speed of the reflexes is what we learn in medical school. You learned it, I learned it. But they covered it very fast. The thyroid controls every reflex muscle in your body, including your heart. Your heart is your largest reflex muscle. If you have a slow pulse rate, it's not because you're extremely fit, it's because you have low thyroid function, and vice versa. If you have irregular heart rate, that means that there's a higher probability that if you have tachycardia or palpitations, that skipping of the heartbeat or rapid pulse rates for little spurts, that you have an autoimmune disorder. So, based on that knowledge, I developed a machine that could simply test the speed of the reflexes. The patient fills out the questionnaire, which includes questions such as, are your feet cold? Are your hands cold? Tip of your nose cold? Are the outer third of your eyebrows missing? Do you have two lines around your neck? There's a whole lot of questions, and for our female patients, it controls the estrogen and progesterone. And of course, I made sure that my daughter, thyroid was balanced so that she did not rule the house when she went to puberty. So because it controls the estrogen and the progesterone, and also controls your weight as well. In other words, it totally controls how many calories you're burning per day. So the patient fills out the questionnaire. The questions are straight out of my endocrinologist handbook. If you score more than 8 on the questionnaire, we test you. That's the basis for the testing. The test is 4 minutes. We test the speed of your neurotransmitters. In one easy test, we test the speed of your reflexes and your resting metabolic rate. We have the answer, concluding putting the patient data in 4 minutes, so we know whether to dose you or not, or titrate you if necessary.
What are some of the most overlooked symptoms of thyroid dysfunction?
is pretty easy. As soon as I shake a patient's hands, if they've got cold hands, I suspect that they have a thyroid condition. That's the most obvious one. The second one is a weight gain. I can't, pretty hard to see, but from here downwards, from here down to the tops of the legs, the weight keeps on going year after year. A little bit of hair loss is quite obvious. The outer third of the eyebrows is quite obvious. Puffiness underneath the eyes. So there's some obvious signs besides a lot of the more subtle signs. For instance, a hypothyroid patient cannot walk in a straight line. They'll walk to the left or walk to the right, which means they'll bump into furniture or doorways. What's wrong? So there's a lot of symptoms that are caused by thyroid function. Some of them easy to spot, and some of them the patient must tell you. In other words, the body gets low and slow. For instance, constipation, because it affects the brain, depression, anxiety, they're all triggered by low thyroid function.
Yeah, I definitely think of the thyroid as I call it the airport control, the control center.
Yes,
Directional. You do this, you do that, but the master kind of controller of body temperature, metabolism, energy distribution. Assessing where does energy need to be mostly conserved or utilized in that way.
Okay.
So,
can I explain that a little bit,
sure.
Dr. Alya?
Yes, please do.
You're exactly right. The energy center. To put into layman's terms, the engine of a car needs energy. There's petrol or gasoline to make it fire. It needs water and it needs oil to make it work smoothly. Your mitochondria is the car engine inside your body. It has all the cells, and for them to perform, they need thyroid, D3K2, and iodide. If you don't have those things, three things in balance, your energy production or energy output is not going to operate same as you having a 6-cylinder car and operating on 3 cylinders.
Why do thyroid disorders affect women more? Just, that's what I see, and that's kind of what the data reflects on, that women are disproportionately more affected.
Get asked this question a lot. It actually affects as many men as it does women, but women talk to each other.
Yes.
Right?
Yeah.
They talk over coffee. They talk about their menstrual cycles. They talk about babies. They talk about anything. Men, we're all tough heroes. We don't talk about anything like that. So women are more aware of their bodies. Plus, they get menstrual cycles as well, which is controlled by the thyroid. So they get to talk about these things a lot more openly than what men do. Men, if they start to get rapid heartbeats, tachycardia, they're not feeling good, they're low on energy, they clamp up.
Right.
Woman, get on the phone. Hey, come over for a cup of coffee and we'll talk about it. Women, our female patients are a lot more open to talking about it. So it only appears that it happens to more women than men.
Mm-hmm.
But it is hereditary. In other words, I'm a genetic DNA specialist. That's what I delve into in this path that I go down, especially with autoimmunity. Genetic defect. If the gene is passed on to your children, then doesn't matter if it's male or female, they're both going to have the same genetic defect.
Yeah.
And by the way, if you have it, Dr. Alya, which I can't tell from across on the other side of the world, but your brothers and sisters will have it as well. Your siblings will have it.
Well, we do have I think there is an effect on migration, I would say. When dietary or stress levels change, I do see that certain times conditions that weren't really prevalent in one area of the world, and then when patients move due to either change in weather or the environment or even to their circadian rhythm, location, stress, nutrition, definitely has an impact on thyroid health, but that's in general. As well. What concerns do you have in just relying on TSH, a thyroid stimulating hormone, which is a way that we test in conventional medicine, we test the TSH as a screening to see about thyroid health. We're just testing that alone. And there are many places that only rely on TSH. And if that's normal or abnormal, action is taken only then when it's abnormal. But there's some concerns around just relying on one laboratory way to assess thyroid health.
Don't forget what Sir Dr. Richard Baylor said. None of the blood tests are valid. You can't rely. They're 18% accurate. So what I do is 98.5% accurate. Therefore, they're just not valid. I mean, that is why so many people end up in the club, as I call it, the subclinical hypothyroid club.
That's correct.
They have all the symptoms, but their bloods don't match. So we do not rely on bloods for that. We do rely on bloods for Graves, Hashimoto's, and reverse T3. They are accurate, and we will act on those blood results. But bloods, if it's hereditary, is hereditary. And talking about different cultures, for instance, 18% of everyone in the USA has Hashimoto's. In India, for instance, where I've just come from 2 days ago, 60% of the population has Hashimoto's autoimmune, and that is due to the diet. In other words, lack of iodine. Iodine is the main trigger. If you are born and inherited a thyroid condition, lack of iodine triggers an autoimmune response. And if you, I was vegetarian myself for 23 years, and that is why I got cancer and my wife got cancer. Now, both of us are cancer-free.
Why don't you tell us a little bit more about Hashimoto's disease and
I'd love
to.
about
that? Yeah.
Yes. Hashimoto's is an autoimmune response that affects everyone in the world. It's a precursor to the Parkinson's, the shaking disorders, which we test for. It's a precursor to Alzheimer's. For instance, 50% of all Alzheimer's is caused by the autoimmune response, and it's called the slippery slope of autoimmune responses, going down to MS, MG, Guillain-Barré. The list goes on and on and on. Hashimoto's, I discovered how to reverse it in my clinical trials on 2,200 people over 3 years, on peer-reviewed, published, FDA approved. I have all the approvals around the world, and we found out how to reverse it. In other words, the first place that it goes to is the digestive tract. The digestive tract has a negative feedback back into the brain. So it starts to cause problems with the functioning of the brain as well as the digestive tract. And of course, it keeps on getting worse and worse and worse. In fact, if you don't fix it, it cuts 6 years off the average expected life expectancy. We have a very, very simple method of reversing Hashimoto's. Painful. It takes us 1.5 years, but we pull you out of the brain fog, the digestive problems, and all the cascade of autoimmune responses that you do not want to go down. And may I add on, there's another category called hashitoxicosis, where you have Hashimoto's and Graves, and in that we do a DNA test. So it's within your DNA, and we do an RNA intervention in that case, which is a little bit more complex.
Yeah, I mean, there definitely appears to be a cycle of function changes in the Hashimoto's kind of spectrum of how that presents, whether it's low-functioning thyroid or high-functioning thyroid dysfunction.
Or swinging.
The antibody response.
Yes.
I often see patients with Hashimoto's and their antibodies are elevated, and then you treat their stress, their depression, or whatever is triggering that autoimmune response, their immune system. So the question that I have is, tell us a little bit about, first of all, testing, as I want to focus on your Thyroflex, how it would pick up, the variation of the thyroid, high functioning, low functioning, and then a comment on, your body's own way of self-treating kind of that thyroid dysfunction once the source or the root cause of that thyroid dysfunction is determined, whether it's stress, nutrition, or all the combination of.
Yes. We always address nutrition and exercise. In fact, all of our autoimmune patients automatically go onto a paleo diet. It's from the day of the first discovery that they have autoimmune is exercise and diet plays a major role. If it's stress, we use music as well to modulate the brain waves, and we have to address the sleep. Addressing the thyroid alone does not resolve a thyroid problem. It involves sleep, the iodine, the stress modulators, and the adrenals. So they fill out the questionnaire for all of those things. If they score 8 or more on the questionnaire, we test them on the thyroid machine, which tests the speed of the neurotransmitters, the reflex time, and the resting metabolic rate. But if they have tachycardia and or palpitations, we automatically run the TPOAB and TGAB. That's the Hashimoto's and Graves test. If they score more than 13...
And those are just the antibody tests, just for our audience, so they know.
That is the antibody test. That's correct. Yeah. And that's how we pick it up. And it's very good at picking that up. And then if they score more than 13 in the stress, the cortisol part of the questionnaire, that automatically triggers an RT3 test, reverse T3. We have really easy protocols for all the above, but if they have Hashimoto's and Graves, that triggers a DNA test, and we do an RNA intervention. Most of these interventions and treatments run concurrently with any other treatments that you're giving the patient, because this is addressing the core hormones, and it's sort of quite separate from the whatever else you're treating the patient for. I hope that answers your question.
Yes, it answers one part, and I'm very curious now because I've got another question, because I'm always very curious. Show us, do you have the device? Is there some way you can kind of explain to us kind of what this device testing, is it just a reflex hammer? Is it?
Yes.
I'm sure it sounds more technical than that.
We get the arm, we have a plunger that comes down, induces a reflex. It's called a Thyroflex.
Yeah.
And it's a 4-minute test. We have about 800 centers around the world that do the testing. And if your office wants to put one in, that's okay. But you're in California, correct?
Yes, I'm in California. I'm very curious to see this.
I have some famous centers there that test it, like the Hall Center, Dr. Prudence Hall, Kent Holtorf, just to name a few. We have centers everywhere.
Yeah. So it picks up the reflex response, but isn't that
the reflex response? You can dose and titrate straight away. There's no need for blood tests because they're not valid. Simple, unless they are autoimmune or RT.
Okay. What role does iodine play in thyroid health?
I've been waiting for that question. Thank you. Iodine is vitally, vitally important, not only to make the thyroid work, but to actually lower your risk of breast cancer, uterine fibroids, the thinning of the uterine lining, that's the endometriosis, cysts on your ovaries, and of course, our men, prostate enlargement. We have an iodine testing machine as well called a Thyroid, and the iodine knocks one of the T's. There's something called T4, comes to TSH, then it comes TRH, TSH, T4. You've got to knock one of the ions off the T to make it into T3. It goes on a sideways move. Then it's got to go on a vertical move. But the I2, the ion, knocks the ion off the T to start to make it into a usable form. Be freed up for intercellular use, and that is where the hormone D3 comes into play.
Yeah, so iodine is used to convert from T4 to T3.
It's absolutely essential. If anyone is on thyroid, you've got to be taking iodine. It's as simple as that. Otherwise, it's like the car of an engine car, the engine in a car. You've got to have oil, water, and gasoline to make it work. Same with the thyroid medication. You're going to be able to convert the T4 into a usable form of T3, which with the D, the hormone D, and the iodine frees it up for intercellular use, which is called free T3.
Are we seeing an increase in iodine deficiency in the world?
In India, for instance, it is severe. And I talk about India because I've just come from there. But anywhere there's a vegetarian diet, it is severe because there's no iron, iodine in the diet. According to the World Health Organizations, most countries are now iodine deficient. Iodine used to be in our diets in the form of seafood. It used to be in our vegetables and fruits, but with intensive farming, it is no longer there. So an iodine salt will not do it. You've got to really take an iodine pill now.
And what are some misconceptions about iodine supplementation? How can you do it safely and make that assessment first and then the supplementation recommendation?
We have an iodine testing machine, but you can do it symptomatically to start with, because we know that 98.5% of the people around the world, in America actually, are iodine deficient. You look for the two lines coming right around the neck. That's the goiter lines. And you get them to take their tongue out, and you see scallops along the side of the tongue. The tongue is slightly thicker than normal. That's some of the...
Let me see if you can see my...
But turn your head side. Yes, you actually have it.
I have a little scalloping.
Yeah, you do.
Wow.
Because iodine enlarges the tongue and pushes it against the teeth. But we have an iodine testing machine. All of our bigger clinics do a pre and post, which is a urine iodine test for sufficiency deficiency, followed by a saliva test to see if you're uptaking the iodine that we give you, because bromide, fluoride, and chloride can stand in the way, which you find in your breads and your water.
Yeah, very true. There are some other, I guess, elements that interact with iodine that prevent absorption.
Yes.
Bromide and fluoride. Fluoride, you mentioned fluoride, correct? Which is in toothpaste. Does that
fluoride,
have an
yeah,
effect?
I use a fluoride-free toothpaste, for instance, and I try and do everything fluoride-free, and bromide-free.
So
in other words, I use...
You mentioned the sources of iodine being seafood. Is there a deficiency in iodine in seafood? I'm an avid seafood eater. I love seafood. How much iodine would you say is in, if you have a high intake of a healthy, Mediterranean style diet with plenty of seafood?
Well, the most healthy intake of iodine is in Japan, where the incidence of breast cancer, uterine cancer, ovarian cancer, and prostate cancer is extremely low, because they take an average of 2.2 kilograms of fish a week. And out of that, they get an average of 13.2 milligrams of iodine. We actually make a supplement, 12.5 milligrams of iodine, which, according to the research by Abrams, Fleischer et al., and put into practice by David Brownstein, which we have continued on with, seems to be the right amount of iodine for daily consumption. Not forgetting that iodine flushes out of your body every single day. So you must do it on a daily basis. But about 12.5 milligrams is a good intake. So if you're eating a Japanese diet, you're spot on. If you're not, you may need a little bit more iodine.
Yeah. And I do want to relay the importance of assessing. The thyroid is so critical of an organ, I would say, in the body, and has an effect on the not only the circadian rhythm, the hormonal cycle, as you've mentioned.
That's why we address sleep.
And motility, gut motility, absorption, again, sensitivity, environmental sensitivity. You mentioned mood and cognition, focus. I mean, it's just it's centrally located. So it's right here for our audience.
Right here, yeah.
And it does tend to get enlarged. When you have iodine deficiency, we call it a goiter. But by that time, it's obviously too late, I would imagine. And it tends to shrink or involute as well. And there's cancers that can also develop in the thyroid. So it's, there's several areas that it comes under attack, being a very critical organ, under stress, under, as I mentioned, nutrition. Tell us more about how thyroid dysfunction can affect fertility, pregnancy, hormonal, perimenopause, menopause.
Absolutely. First of all, your thyroid, if it's not in balance, and this is hereditary, it's not your fault, affects your estrogen and your progesterone. In other words, the first thing that shows up is your menstrual cycle is not 28 days. It might be 27 or 29 or any other days other than exactly 28 days. If it's not 28 days, you have a thyroid problem that's affecting your estrogen. And of course, your progesterone means that you should not be getting any clotting. You should, and your menstrual cycle should last for 3 days. Do a bit of spotting before and afterwards. That is the just on the menstrual cycle side. If your thyroid is not right, and this is why up until 1900, only 30% of the people had thyroid disorders, it's now 80%, is because it was very difficult for a menstruating woman to conceive. If they did conceive, the high probability of having a miscarriage, which was really, really stressful on the entire husband and wife relationship. And she may have 1, 2, or 3 miscarriages. And then finally, if a fetus does stick past the first trimester, high probability of a premature birth with all of the problems of having a premature birth. Your question is spot on, Dr. Alya.
Thank you.
The thyroid plays a critical role in the estrogen, progesterone, and the ability for a woman to conceive and carry to full term a viable fetus. So not only that, the iodine, which you just mentioned before, the female patient must have enough iodine, that's 12.5 milligrams of iodine, to wire the brain correctly and increase the IQ of the child, similar to the folic acid that we discovered many years ago that used to cause a cleft chin, hair lip, cleft palates, which I deal with, by the way. I volunteer in a place called Bangladesh. I do them free of charge. Nasal passages, spina bifida, from lack of folic acid. The same with lack of iodine.
Yeah, I would say folate acid.
Yeah, folate acid. I'm from a different country, so
yeah, that's okay.
It's a B vitamin.
Yeah.
But just the same as that, folate acid is essential for a pre-pregnant woman, preconception. So is iodine, because we're able to increase the IQ of an unborn child by 10 to 12 points. They actually, with the combination of the right amount of thyroid and the right amount of iodine, we are able to have a healthy fetus, a healthy baby with increased IQ, which makes a difference for their baby's entire life. And it gets rid of all the ADD, ADHD, all the alphabet soup of problems that an unborn child may have to face from a simple lack of iodine.
Yeah.
And of course, they also are going to have their thyroid functioning a lot better.
Yeah. Well, sounds very exciting. And I'm going to switch gears to really ask you questions about the future of thyroid assessment. What advances in thyroid diagnostics are you most excited about in the next few years or in the next decade?
DNA. I think that we'll be able to, because I'm a DNA RNA specialist, the DNA, and I think that we'll be able to pick it up from preconception. This is what I'm excited about, by doing a DNA test and correcting the problem before the fetus is born into a child. That is what I'm excited about. I do a lot of DNA testing now, and there's a definite genetic pattern, not only for the thyroid, but in the autoimmune component. And of course, we are looking for certain things like the interleukins, the CA. There's a whole lot of genetic markers that I go and search for that tell me the story of how I can help the patient. But I think that eventually we'll be able to reduce the 80% down into a far more manageable number, or commence treatment from which is similar to what they do now when they
Yeah.
do the kick test, where you have got to commence a treatment from birth, but a lot easier because the current method of doing the blood prick test is not going to tell them anything. But the DNA tells you the whole story. There's no
Yes,
escaping that.
definitely. I think we have the ability to do that even now. And, we're just putting it into application. What
Yes.
changes or what message would you, since you are a speaker and you travel the world and have lived across many, parts of this world and the planet, what would you like to see changed in healthcare education or for healthcare professionals related to thyroid education?
Number one, thyroid balance gives you quality of life. If you want your patients to have quality of life, which is what we as doctors want, right? You got to stop using blood. It's been well proven. There's a brand new research book out going into all of the major teaching hospitals around the world by a very good friend of mine called Dr. Dietrich from Germany, and he states categorically they have proven mathematically, not statistically, that none of the bloods are valid, and the only thing that is valid, he mentions me in his book, this big, thick, really hard-going book, not for the casual reader, that the only way around it is going back to the basics of testing. We want to give back quality of life. My message is if you are suffering from cold hands, constipation, or the myriad of symptoms, which you can easily look up and in fact most women talk about anyhow, then go and seek help from a testing center that actually tests the speed of the reflexes. Some old doctors know how to do it visually. Otherwise, you should really be tested on the Thyroflex, which is 98.5% accurate, and it's fully approved.
Well, I'm going to ask you some rapid fire questions. So you can,
Sure.
I'll ask you the question and you can give me your first response. That'd be great. It's a new thing we started at Too Curious MDs. So what's the most misunderstood thyroid myth?
Blood tests.
Most common symptom patients ignore?
The brain being cold and the brain not functioning properly, tired and exhausted.
Most important lifestyle intervention for the thyroid?
Diet.
Biggest mistake practitioners make?
Using blood.
One
as
lab,
irradiating.
one lab marker clinicians rely too heavily on.
I missed the question.
One lab marker that clinicians or doctors rely too heavily on.
TPOAB.
One thing every patient should ask their doctor.
Ask me my symptoms. Doctors don't anymore. Don't have time.
One prediction for the future of hormone medicine.
Natural bioidentical is the only thing that works. We've proven it over and over again. That's got T1, T2, T3, T4, and T7 and not synthetic T.
And before we close, we always ask our guests, since we are Too Curious MD. I am one of the MDs here, but the other colleague is not here today, Dr. Alya Ahmad. So that's why we go by Too Curious, but we're also TOO, Too Curious.
Yes, I read that.
What would be a question you'd like to ask the audience or for our next podcast or something that you're curious about?
I'm really serious about autoimmunity. I'd love to do one just on autoimmune alone because 18% of your patients have autoimmune. They're struggling through life. Their life is deteriorating, and I know what to do. I have the answer. I have the answer to what they're looking for.
So thank you for being here. If somebody wanted to learn more about your product, your work that you're doing and listen to any of your talks, where would they be able to listen to that or look you up?
On www.NiTek Medical, NiTek Medical.com. It's easy to find us there. If any further questions, you can email us and we will send a response out.
Thank you.
Alya, thank you very much for having me on your program. I thoroughly enjoyed it. And this whole message is about regaining your quality of life.
True, really. And it can be done. And I think that's the most important message that I'm getting, that we can look for it earlier than we don't have to wait till we fall off the cliff to fix something. You can actually
Yes.
intervene earlier. And what I learned also is that paying attention to those subtle symptoms like your tongue, like the temperature sensitivity, or
Attitude of your eyebrows,
things that
everything.
things that often don't get asked. So, and also you know your body and listening to your body because it has the answers and it's giving you a signal, to pay attention to. So paying attention to that earlier rather than later makes the biggest difference. And nutrition is key. And of course, I also learned about iodine and the importance of iodine and knowing how deficient we are, largely due to the way we're living and our sources of food that we're getting, and also the less of that exposure that we would have naturally.
Thank you
To
very
correct
much.
that. So thank you for being here. Okay.
That's beautifully summed up. Yes, thank you very much for inviting me on, Dr. Alya.
Thanks for joining us on the Too Curious MD podcast. We hope today's episode inspired you to ask new questions and explore fresh perspectives. We challenge you to ask us those unasked questions that you're curious about in your medical practice, condition, health, and wellness.
If you enjoyed the podcast, don't forget to subscribe, share it with somebody just as curious, and leave us a review. It helps us keep the curiosity alive. Post or comment with a question or curious inquiry that you have and seek to explore or learn with us. Stay curious, and we'll see you next time.